that I've not had the chance to meet yet. My name's Donna Dyson. I'm a National Marketing Director with the Juice Plus Company, and it's always my privilege and pleasure to be able to host these luncheons. All right, let me tell you a little bit about our organization. As a member of the Tomball Chamber, this is the Health and Wellness Committee that puts these together. And the Greater Tomball Area Health and Wellness Alliance is a collaborative effort among healthcare entities, providers, and businesses in the Greater Northwest Houston region, providing health and wellness related platforms to support economic development. We focus on providing opportunities which support healthcare professionals and wellness initiatives for a healthy and vibrant community. That's my favorite part of that, is that vibrant community. And I love serving. So our members, our chamber members, we meet on a monthly basis and we plan these events, and we work really hard to pull information together that we think the community will benefit from. And we get to introduce our speaker. This is what you guys have been waiting for, and let me tell you a little bit about her. Toni King is an author, a columnist, radio and TV personality, and she has spent more than 27 years as a top sales leader in the Medicare and health insurance fields. She has also conducted Confused About Medicare workshops throughout Texas and the southeastern United States. In 2009, Toni was holding a Medicare workshop in Greenville, Mississippi, when a member of the audience asked a question about his not meeting Medicare Part B. Toni met with a gentleman after the workshop, and it didn't take her long to find out that he had received wrong information from his Social Security office. It took a couple of days to get this overwhelming problem straightened out and get his Medicare Part B taken care of. When it was all finished, her role as an insurance agent had changed to that of an advocate for people on Medicare. It was then that she took the Medicare and You handbook and put it into people terms. Who's had that book? Right? Having it in people terms is so important so the average person can understand Medicare. So whether Toni is consulting with a client in the office or giving a Confused About Medicare workshop to hundreds of people, she emphasizes her mottos: Medicare is not cookie cutter, and what you don't know will hurt you. Not understanding the rules and guidelines of Medicare can cause you to make costly mistakes that will last a lifetime. Whether you're helping your parents understand Medicare or choosing a plan for yourself, let Toni show you how to navigate your way through what has become the Medicare maze. She lives in Houston, Texas. She often says she believes red, white, and blue. She's a native Houstonian, and her family's restaurant, Angelo's Fisherman's Wharf, was a Houston landmark. For those interested in having a Confused About Medicare workshop for any of your groups or churches, companies, you guys can talk to Toni after the event and let her know that. So please give me help me welcome Toni.
Thank you. Thank you. Can you hear me? So what we're going to do, I'm going to take y'all, I am here for educational purposes only, okay? I am not here to sell you a plan. I am not here to make you change what you have. Everybody in this room needs to realize that they are a walking dollar sign. And right now, don't you feel like that? How many of you guys get bombarded with phone calls and you just don't know what to do? Let me tell you something. The best thing to do is hang up. Literally, you are not going to hurt their feelings. So that's what I do. That's how I run my workshops. And this is going to be different than any workshop that you're going to go to, because in about 2 weeks, they're going to start having workshops for Medicare's. It's now called the annual enrollment period. And you're going to be bombarded. So write your questions down and we will get them. And yes, this is a Confused About Medicare workshop. And what you don't know will hurt you. So I am now at 15 years doing this. What I did was I took, how many of you guys got the book in the mail on Saturday? You got your Medicare and You handbook. I went over, you did, yeah, really? Seriously, Jim?
Seriously.
I went over to somebody's house on Saturday. He thought he got a catalog. It was not. It's the Medicare and You Handbook. Why do you think this thing comes out so early? It's not so you understand Medicare because there's no new numbers in here. It's because on the back of the book is all the Medicare Part D plans and the Medicare Advantage plans for next year. We're getting ready for marketing. Okay? So if you got questions on that, write it down. If you don't feel comfortable about what you've chosen, write it down. And like I said, this event is for educational purposes only, and this little picture up here is supposed to be me. Does it look like me? I don't know. Okay. And if anybody needs a personal consultation, we do them by Zoom or by where you can come to the office. And this week, I got an email from a client who came in. The husband was getting on Medicare. The wife wanted to know what they needed to do. They were deciding they were going to go on an Advantage plan because, they want all the fun stuff. Well, guess what? The husband got cancer. When I explained to him the rules that I'm going to explain to you today, he understood the importance of Medicare, getting Part A and get Part B at the right time. And he ended up going with the Medicare supplement. Now, 3 months later, he's got cancer from the top to the bottom. He didn't know. And it's going to make a major difference in his life. So you have got to personalize your Medicare. Does that make sense? Is that a good thing to hear? Were y'all planning to hear that? So I am now part of a group called Senior Resource. You need to write this down, or you can go to my website. They have a wonderful website. Everybody that has a booth here, somebody like that is in that website, and you can learn from it. You can learn about assisted living center. You can learn about personal care homes, getting on hospice, whatever is going on. It's very valuable to know that information. It's also where I have my podcast. So each week we do a podcast, and Jim is over here. Raise your hand, Jim. He helps me develop the podcast. And there's my office. I'm in Sugar Land. I'm going to go through this real fast because I want to get to Medicare. And this is Medicare. This is what your Medicare card looks like. Some people have no idea what the card looks like. We call it the red, white, and blue card. You got Medicare Part A and B. Medicare's Part C is your Medicare Advantage plans, and Medicare Part D is prescription drugs. All right? But Part A and Part B is what got started July 30th, 1965, when LBJ flew to Independence, Missouri, and signed Medicare in law in front of Harry Truman. That is original Medicare. So we got a to-do list. Everybody gets a Welcome to Medicare kit when you are enrolled in Medicare. And we'll get into the enrolling in just a minute. I'm going to go over that real fast. Kind of give me an idea of what you guys want to learn from today. Just let me hear from 3 people. What is it you want to know so that I'm not going down the wrong path? Somebody want to tell me? Yes, ma'am.
The changes for 2004.
The changes that are happening in 2024? Okay. What else? Yes, ma'am.
And the best plan for coverage when you have a parent who is really ill?
The best plan for coverage when you have a parent that's really ill, okay? How many in this room are getting on Medicare for the first time? How many of you guys do not know how to enroll in Medicare? Okay, so we're going to go over that. I am not going to be able to go over the 2024 numbers because I can't by law talk about them until after October 1st. I can give you some ideas, but you can see me afterwards, but by law I can't talk about it because we can't release it until October 1st, okay? So we'll talk about how to enroll, what you need to do when you're turning 65, or you're leaving your work, and what you can do to help your parents. Because I just got through putting my mother in a personal care home. I know how this works. How many vets do we have in this room? Veterans. How many wives of vets? Okay. Y'all got to know you have benefits that the VA can give you and can help you, and it's important. And I'm sure there's a few tables back here that can help you. Okay, was it Mosaic? Yeah, there's a few tables back there that know the veteran benefits. Okay? So this is your Medicare initial enrollment period. This only happens when you're turning 65. 3 months before, the month you get on Medicare, and 3 months after. This is for someone who is turning 65, maybe you have an individual health plan and you're still working. You haven't gotten your Social Security check. Or this is for someone who is already on Medicare and you've gotten your Social Security check. But after the 90-day window and you don't enroll in Medicare, see the sad face? You're in trouble because you didn't enroll the right way. If you are turning 65 and still working, that's very, very, very important. You want to make sure that you get on your Medicare the right way. I'm sitting here watching somebody, her mouth just went, huh? I have my Medicare survival guide in the back, and we're going to give y'all a $5 discount. Instead of it's $25, we're going to do it for $20 today. And I have my Mesa Medicare. This has all the rules. Mesa Medicare is the only book that has scripture with it with Medicare. I see people come in with so many different kinds of drugs for depression or anxiety or whatever that I decided to put scripture with it because we need some positive resources to help people. Okay? So y'all can get those back in the back if you need to. So if you're turning 65 and you're receiving your Social Security check, I had someone ask me the question about that when she walked in. If you're not working, go ahead and get your Medicare. But if you are working, we need to look into it because it might not be a good option for you at that time. You've got to customize this because once you get Part B of Medicare, and maybe you want to get a Medicare supplement down the road, you might have to answer health questions. So this is very, very, very important, all right? If you're turning 65 and not receiving your Social Security check, that was me. I was on Christian Medicare. That was my individual health plan. I had a $6,000 deductible. I went to original Medicare with a Medicare supplement, but I had to enroll online through the Social Security website because I'm not getting my Social Security check to get Part A and Part B of Medicare. You gotta understand, Medicare does not know how to enroll you. Does that amaze you? They don't do it. Social Security does all of the paperwork for Medicare. There's 3 family members with Medicare. You got the IRS, Social Security, and Medicare. And they know everything about us. Okay, so those are the 3 people that control it. So don't think that Medicare is going to just send you a card when you're turning 65 if you're not receiving your Social Security check. They don't know you exist. And if you wait past your initial enrollment period, you got problems. If you're not working full-time with True Company Insurance. Now is there anybody in this room who's still working and wants to know what to do? Are they? Okay, we got a whole table over here. We got a lot of car people. So if you're still working and you want to get on Medicare, then you've got to file forms. And if you change jobs, you got to get each one of those jobs to sign a form. And you take these forms, it's called the CMS L564. Take these forms to the Social Security office and you enroll in Part B of Medicare. Now, why do you think it's written in red up at the top? Because you could be enrolling at a time when someone that never enrolled in Part B could get a penalty. And I was talking to a lady from Social Security, and my client that I went to go see at their house, she ended up having a 2-year penalty. We could not figure out why she had the 2-year penalty at all, whatsoever. And I'm talking on the phone to the lady from the Social Security office, and she says, oh, did someone write special enrollment period in red? They used to call them, they would download the form and mail it to you. They did not write special enrollment period in red at the top. She didn't know, so she got a penalty. That is how I found out you got to put special enrollment period in red at the top. Is that confusing or what? Does that make a sense? So whenever you get your form, always write special enrollment period. Because how many of you guys want a penalty in this room? Raise your hand. I don't get any hands raised. Isn't that your biggest fear with Medicare, that you're going to get a penalty and have to pay it forever? So that's what you've got to do. Then you've got to take the form for Part B. What if you never enrolled in Medicare and you don't have Part B? Then that's what we help you do. Get signed up so you have Part B. You got to do the application for Part B and you say, I want my Medicare to start January 1st, 2024. No problem. We got it. Okay? So what we're going to talk about, I'm going to go over this briefly. This is original Medicare, Part A, Part B. This is what the doctor's office calls traditional Medicare. This is what Medicare calls original. You will never see traditional Medicare in the Medicare New Handbook. It's original Medicare. That's Part A and Part B. And don't get caught up on the numbers, because right now the deductible is $1,600 for Part A, not once a year, but 6 times. This got started July 30th, 1965, when LBJ, like I said, went to see Harry Truman. The cost of Medicare was $40. The premium was $3 for Part B. Wouldn't you say we've come a long way? But they didn't have chemotherapy. They didn't have radiation. MD Anderson wasn't doing the great things that it's doing today, were you? I mean, things have changed. All we had was maybe a blood pressure med. We didn't have Ozempic and Dupixent and Xarelto and Eliquis and all those prescriptions. So things have changed. All of this information is in my Medicare Survival Guide, okay? So that's Part A, and Part A covers an inpatient hospital stay. You got Part B, which is your deductible, and for this year, the deductible is $226 once a year. That is my out-of-pocket. That's Jim's out-of-pocket, right, Jim? Yes. It's amazing, okay? So I am not on a Medicare Advantage plan. I'm on traditional Medicare with a Medicare supplement. It all depends on what you want to do, okay? And then you've got your cost. It is income-based. If you make more, you pay more. And we do have people that come in the office who are making more than $750,000 a year, and their Part B will be $560. Their D will also have an extra amount. Medicare also has 2 girlfriends. We got Maggie, modified adjusted gross income, and Irma, income-related monthly amount. Okay? And they're like the Kardashian sisters. They love spending your money. All right? So y'all write your questions down. Has anybody got some questions? That's good. Hopefully this thing turns. Okay. So then we got a Medicare supplement. This goes with original Medicare. And you can go to your doctor before you're getting on Medicare and ask him, which is the best plan for me? You may be someone that doesn't go to the doctor very often. Hey guy, it only takes once. Christopher Reeve did not plan on falling off a horse and changing his whole life. It happens that fast. Or you can go with an Advantage plan. So when you first get on a Medicare supplement, this fills the gaps. So my out-of-pocket is $226. I pay the Part B deductible. It just depends on which plan you pick. But what you've got to know is that you have freedom here. You can go to every hospital and doctor nationwide who accepts Medicare. Okay? That makes a big difference. Except for Kelsey-Seybold, who only uses their Medicare Advantage plan. And they're a great plan. They're a great company. Okay? And then here's what's important. This is why you need to treat Part B like it's gold. Because when you first sign up for Medicare and you first get Part B, you have a 6-month window that you do not have to answer one health question. I mean, if you've got to have some type of serious surgery or whatever, poof, there you go. It happens. And you can do it. But after 6 months, and you'll see, I don't know, do any of you guys cut my articles out in this room? Maybe. A couple people do that. You'll see that people cut out the articles, and it explains what happens after Part B. You have to answer health questions. So if you're someone that's got a diabetes, or maybe you've got asthma, you've got some kind of oxygen issue, now you have COPD, you've got cancer, there can be all sorts of different situations. You may not be able to get a Medicare supplement because you can't answer the health questions. So this is very important. You want to treat it like gold. You don't throw your diamonds and jewelry away, do you? Maybe you do. Nobody's answering me. Do you? No, you treat it very important. You treat your grandkids very important. This is important. Okay? So here's the chart. Everybody's got the same chart for your Medicare supplement. Okay? And they've got different rules. I'm not going to go over it because I got to get through so you guys can answer health questions. But we can sit down. The specifics on this is in the Medicare Survival Guide. My book is not something, you get some that will market to you and just give you basics. It gives you everything you need to know about Medicare. And if it doesn't give you your answer, we can help you with your answer. So here's where the marketing is coming. This is what's happening October 15th through December 7th. This is Medicare Advantage plans, okay? And most of them are HMOs and PPOs. How many of you guys are getting phone calls like every day? After October 1st, it's going to be disastrous. And most of the call centers are overseas. How do they know about Medicare? They don't even know about health insurance, right? Maybe. So with the Medicare Advantage plan, you want to make sure that you stay and obey their rules. They tell you where you can go. They tell you what you can do. They tell you whether you can get on skilled nursing, whatever your situation is. You need a transplant, they tell you where you go for your transplant, whatever the situation is. They have to take care of your health care. But they're going to take care of your health care not in the specific places you want to go. If you're someone who's using MD Anderson, and I hate to keep going back to MD Anderson, but I'm sorry, they're important. And that is where your doctor is. and you pick an HMO for a Medicare Advantage plan, you may not be going to MD Anderson. Am I correct back there? Okay. You want to make sure that you talk to your healthcare provider, talk to your doctor, talk to the clinical nurse, whoever's, and ask them what plan is best for me. And they will tell you. Get your kids involved, guys. Everybody needs to have a durable power medical, what is that called? Anybody an attorney in here? Durable power of attorney. You can tell. Hey, I was driving 80 miles an hour coming down here from Sugar Land. Don't tell the police, okay? You want to have a living will. You want to have a DNR, do not resuscitate. You want to sit down with your kids and get everything together so that they know what your situation is. Don't let them come down at the very end and try to figure all this out, because it can be very daunting. Okay? That's my FYI. Was that a good FYI, Jonelle? All right. So you got to obey their rules. You don't lose your Medicare, you just don't use your Medicare. You put your Medicare card away and the insurance company pays your claims. Medicare is paying them each month for your care. Don't ask me how much they're paying you, because I have no idea. That's where the star ratings come in, okay? And then we got the fun time. You got Part D, the prescription drug plan, and there's changes for Part D for next year that are going to be good for diabetics. And from what I understand, catastrophic coverage is going away. So I don't know until they start showing it all really October 1st. But what you got is you have two different ways that you need to get a prescription drug plan: standalone or with the Medicare Advantage plan. Whenever you're getting on Medicare, get a prescription drug plan. And GoodRx and Single Care are not credible coverage. Creditable coverage. They have to be a creditable coverage situation, or you get a Part D penalty. Don't go for cheap. It doesn't work. All right? And you got to put all your prescriptions on there. And you can change every year from October 15th through December 7th. Okay? And this is kind of showing you what you've got. This is for this year. These are this year's numbers. I can't put next year's numbers on until after October 1st. But for right now, the deductible is $505. The donut hole starts once the true cost of your drugs grows to $4,660, not your copays. So if you look on here, you see Humira is over $5,000. You go and buy Humira, you're in the donut hole immediately. Some cancer meds are $14,000, $15,000, $20,000. You get in the donut hole immediately. And once you get in the donut hole, then you have to pay 25% of the cost of that drug. The drug company picks up 70%, and the prescription drug plan picks up 5%, which, if I add it up, equals 100%. So you want to make sure that you have all your drugs on here. As you can see, you got Advair, look at atorvastatin. It's going to be $1 copay. Some people do, they have levothyroxine, but they will do the brand name for the thyroid issue. And the brand name, and I forget what the brand name is. Which one's the brand names? Synthroid. They do the Synthroid. That's like $40. That's no big deal. But some doctors say you have to have brand name. Well, Medicare doesn't cover the brand name. You'll have to pay it out of your pocket. Some plans will, some plans won't. The levothyroxine is $1. Wow. Yeah. So, I mean, you got to sit down. Every year, everybody in this room needs to go and open up a Medicare.gov account and do your prescriptions every year. Do your mom and dad's prescriptions every year because things change, seriously. All right? So what happens when you get in the donut hole, you pay 25% of that brand name drug, and the drug company pays 70%, and the Part D plan picks up 5%. Let me tell you something. I see tons of people come in the office for a consultation, and they're on Ozempic. Ozempic is big time. And I think there's another one that's like Ozempic. It starts with an M, and I don't remember. Moderna. And it's helping them lose weight and get skinnier and get their diabetes together. But it's about a $1,500 to $2,000 prescription. Okay? So, I mean, it makes a difference. And when you finally get everything together, you've got your costs for Part B. So if your income is $194,000 as a couple and less, then your Part B is going to be $164 this year and 90 cents. But if it's more, you may pay more. And then prescription drugs also has extra. Remember the two girlfriends, Maggie and Irma? So Maggie is the modified adjusted gross income, the amount, and Irma is the extra that you pay. Y'all are not smiling, guys. Okay, so October 15th through December 7th is what you're getting ready for. Okay, get in the game. Do your research. Open up a Medicare.gov account and put all your prescriptions in. It's not hard to do. Know what you've got. Don't count on somebody to just call you and let them sell you over the phone and you'll never see that person again. You're in big trouble. So, if you need to, go to the podcast and we'll just open it up for questions if we got questions. I don't see anybody writing anything, so I must have done a good job. I must have done a good job. I'm not trying to rush through this. You want to ask the question?
No, it's okay.
So here's a question. What's 40 plus people? I don't understand that. Whose question is this?
That's mine. I'm listening for my children. It's too late. What do they do? They're 40 years plus, because I have two old children that are in their 40s. So what do they need to do to prepare for Medicare?
They don't need to do, we don't know what their Medicare is going to be like. They got 25 years, guys. I mean, we're worried about what's happening with the current people that are getting on Medicare right now. What do they need to do? They need to sit down and look for a long-term care policy for themselves. They need to sit down and get all their living will and durable medical power of attorney and all that together. That's what they need to do. But they also need to know what you're doing. Some parents won't tell their kids what they're doing. They think they're going to get into their bank account. Your kids don't want your bank account. Oh, they might, but. Let me tell you something. My dad had a big restaurant here. He passed away. My mother had no clue. And when she ended up, now I've got her in a personal care home, she had no idea. I mean, it's amazing what happens when someone's past 80 years old, and it makes our life hard. So here's another one. If you're on an Advantage plan, can you switch to Original Medicare? If so, are there any penalties? There's not a penalty to switch. If you're on an Advantage plan and you want to go back to Original Medicare, the first thing you need to do is you can leave your information with Donna if you want to. We can help you with it, but you've got to see if you can qualify for a Medicare supplement. If you can't qualify and answer the health questions, you've got to stay where you're at or get a better Medicare Advantage plan. It's all about health questions.
Here's another one about that same kind of.
Okay. Someone says, please compare original Medicare with the Medicare Advantage in terms of benefits for home care, skilled care, cancer treatment. Look, guys, you got about, how many of y'all back there with the tables work with home care and skilled nursing? Raise your hand. Come on. And then we got the MD Anderson table. Talk to them. Talk to your healthcare professionals. If you're with an Advantage plan and you're concerned about home care and skilled care, you need to find out all the ins and outs of your Advantage plan. Because we have to sit down and look at it seriously as to what will happen. I mean, that's very important. You don't wait until it happens, but you've got to, kind of put a plan together. Cancer treatment, I don't know how that works. But I'm sure the girls over there with MD Anderson know how it works. You've got to look at what's my out-of-pocket with my Advantage plan and what's my out-of-pocket with original Medicare. Your out-of-pocket could be $11,000 with that Advantage plan. Okay? Just because you're seeing premiums are zero and you get your gym membership and now they send you some extra stuff from the pharmacy, but you get sick and now you've got a serious issue. I mean, you got to take time and personalize it and make it your situation. Wouldn't you say? Yeah. Okay. Someone said I had Plan G. It's not part. Medicare supplements or plans. Medicare, your Medicare A, B, C, D are parts. I know we get that confused. But I had stem cell put in my knees. I had to take Plan E. Let's see. Am I required to stay in Plan N? So she changed from Plan G to Plan N, had stem cell put in her knee, and now she wants to know, does she have to stay with Plan N? I'd have to know, we'd have to look at the underwriting for the different companies. That's not a big deal putting stem cell, but some companies won't accept you for stem cell. But you've got Plan N, you're fine. Okay, what we got?
Anybody else?
Compare, Medicare card doesn't show parts, says PPO, C-SNP, Y. I don't know, I'd have to look at your Medicare card. It must be the plan that you're on. That's not your Medicare card. Your Medicare card is red, white, and blue. This is your Medicare Advantage card. Y'all see how confused people are? Because when the agent comes out to your house and sells you that Advantage plan, first thing they tell you is put your Medicare card away. People lose their cards. And use your Medicare Advantage card because Medicare's not going to pay. Medicare is paying that Advantage plan. Did y'all know that? They're like over here going, huh? So, I mean, that's the way it goes. If you're on an Advantage plan, can you switch to original Medicare? I think we already answered that one. How soon before turning 65 should you look into planning for Medicare? That's a great question. Who asked this question? Oh, well, you look like you're 16 over here. Okay, here's what happens, and I don't know how it happens, but here's what happens. 6 months prior to you turning 65, don't ask me how they get your information, but they all find out that you've got a 6-month window, and they start sending you stuff and calling. You get all these calls from the Philippines and from, Jamaica or wherever. They want your information. They start marketing to you. You cannot enroll unless you're getting your Social Security check. You cannot enroll in Medicare except 90 days prior. So they're already watching you, and a lot of them will enroll you anyway because they're waiting for you to get your Medicare number, and they'll come back and get your number. They've already been paid.
Okay, say that again. You can't enroll.
You can only enroll within the 90-day window. Yeah. If you're not getting your Social Security check. But guys, this is important. If you are still working and you've got company insurance, do not be concerned with Medicare. Because if you right, Jonetta? That's right, I told you the right stuff. Because when you retire, you get Part B of Medicare and don't have to answer one health question. Okay? It can be very, very, very confusing.
Is there any more questions?
Let's see, well, I can't believe that I ask any more questions. Maybe
We've
they,
got a smart
are they looking, is there cookies or something you guys need? Where?
right here.
Okay, just tell us your,
Hospital not accept Medicare.
I don't know, you'd have to call the hospital. Why does the hospital not accept Medicare? Most hospitals accept, now is it original Medicare or Medicare Advantage? Which one are you looking at? Have y'all noticed how some of the companies start fighting with the hospital chain and now they're out? And by the time Medicare open enrollment is over with, they finally decided to get things together. That is about a Medicare Advantage plan. Whenever you have original Medicare, the hospital sends a claim to Medicare, and then Medicare sends it to your Medicare supplement. That has nothing to do with this. It just very, very, we got a mixed group. If you're turning 65, this would be a fun group. We could sit here and party. But after you've been on Medicare for a while, you really want to personalize it. What is it that are you finding things out with this workshop? What did y'all want to find? Because some people look just bored to death. What did you want to find out? Are you finding out what you need? Yes, sir.
Company I retired from, okay, I'm taking a supplement plan as chief. Now they're getting ready to change it over. They were cutting the HRA out also. So what they're going to do is going to take away the HRA and just offer a Advantage plan.
Okay, so the company you were working for was helping to pay for your Medicare supplement. And now a lot of companies are changing their plans for you, and they're going to a Medicare Advantage plan. I mean, the big guys are doing that. TRS, ERS, Shell, BP, whoever. So you need to sit down, we need to sit down and look at and customize and see what the situation is. Well, but you guys, you've got to personalize his plan for you, and don't sit down and ask all your friends the same question, because they will mess you up totally. Okay? You don't tell your friends about how much money you've got in your 401k and how you've done this and how you've done that, but you want their information on Medicare. They can't get their Medicare right. How are they going to get yours? Everybody becomes an expert.
Okay, they're still thinking.
They're still thinking?
Yeah.
Okay, retired and sponsors insurance did not enroll in Medicare. Spouses. Spouses insurance only paid as supplement. I don't know, I don't understand this question here.
That's what I was having a hard time wording it.
You really have to sit down. I do charge for consultation, okay? But you do have to sit down and find out what your situation is.
I just knew someone that he came into the office he thought he was covered fully on his spouse's insurance, so he didn't get Medicare. Well, when we filed it, they only paid as a supplement to Medicare because he was retired and he did not roll in Part B on Medicare.
We'd have to look at it, but he was still working.
No, he retired, but his wife was working.
Well, she was, now see, this person's wife was working. So he could go out and file the forms and get on her Medicare. He's got protection. He was under her company insurance. If he came to the office, we would have done it the proper way, got him on Part B of Medicare. He'd have a Medicare supplement. He'd be having a party time right now instead of stressing out. I mean, you got, so why use employer insurance over Medicare, still working at 65? Well, what if you're still working at 65 and you're making $300,000 a year? You want to pay the higher Part B premium? If you sign up for Medicare, we need to get you a Medicare supplement. Guys, I can't answer these questions unless I'm sitting down on a consultation and personalizing it. This is not like, I don't know, this is not like playing Family Feud at night and trying to get the question. This is serious. This is planning. And there's a whole different ball game. All right.
I think, is that all the questions? We have one more question.
What is the best way of Advantage versus this Medicare? You said there before you retire, like I'm 63, I want to decide when I get 65,
We'd have to look at your situation. Like the couple that came in, and you can ask Donna back there, they wanted to go with an Advantage plan. They were retiring. But when we explained the value of Part B, they went with the Medicare supplement. Now the man has cancer. So you gotta look at your situation. I mean, it all depends. You can always go to an Advantage plan because they don't ask any health questions. You can't always go back to a Medicare supplement. It's just not simple. I don't know why I don't have, I probably do. Maybe Jonetta will tell you I do. I probably have wrinkles going all the way down to my toes because this gets stressful. I have people come in that just went to literally I had a gentleman come in who had kidney issues, had gone to the doctor the day before and found out he had kidney cancer. Different situation. I mean, it's we just get a lot of stressful things. Don't we, Donna? So,
will the books help?
Yeah.
The two books. So can they help answer some of the questions that you had posed today?
So what I did, a gentleman came to my workshop in Mississippi, got the wrong information from Social Security that cost him over $10,000. How I knew the answer, I have no idea. All I have is a high school education. I did not graduate from college, and it's Jonetta's fault. We went to college together. Pikes and Sigma Chi's. I mean, what can I say? We were little party animals. Am I ruining your reputation now? We were little party animals. I did not graduate from college, but I knew the answer. And Social Security told him to turn the back of his card up, sign it, and send it back in. He told him he had company insurance. He had retirement benefits. Big difference. Went in the hospital, had a stent put in his heart, cost $10,000. Okay? He had about 6 weeks he could go and get Part B of Medicare because he was in his initial enrollment period. 3 months before, the month of Medicare, and 90 days after. I said, when you get off the phone with me, you better go back to the Social Security office and enroll in Part B. He enrolled in Part B, and Cigna had to come back and pay. So I took the Medicare and You handbook, and with my articles, that's what this is. So I promise you it's well worth the money. And I can tell when someone's an engineer and they come in the office because this sucker is highlighted all over the place.
So that would be a good place to start, maybe,
Yeah.
and then follow up with you if we have questions.
Yeah.
And then I've got up here, you've got your newsletter. That should be helpful as well.
We've got the newsletter, but we've also got what Jim has helped me do to get the podcast through Salem Media is amazing. That whole website is amazing. Okay?
All right. Oh,
Wait, who's Jim?
I think we need to wrap